We hope everyone's having a fantastic day. There's been a lot of rumblings, a lot of discussion surrounding Medicare, Medicaid duals patients. So when you hear me refer to duals patients or others, they're talking about those patients that have both Medicare and Medicaid. The issue is there's quite a bit of complexity. There's a number of different types of duals patients, and then how they're treated and what you can and cannot do with those particular patients comes into play exactly which category that they fall in. So here are the number of different categories, if you will. You've got the qualified Medicare beneficiary, and that's what we're going to spend most of our time on today. We'll refer to those as QMBs for qualified Medicare beneficiary. You've got specified low-income Medicare beneficiary programs. You have qualifying individual programs, and then you have qualified disabled working individual programs. Those are the four. Based on the information that Medicare put out, approximately, more than 65% of duals eligible patients are all QMB, or qualified Medicare beneficiary. And the reason why that's important is there are billing restrictions that are placed on your office for them. And what that looks like is you are not able to balance bill the patient for any covered service item for the deductible or for the coinsurance. So that means that if you provide a CMT, a chiropractic manipulative technique, then at that stage you are unable to bill the patient for any deductible amount, nor are you able to bill them for any coinsurance amount either. So the 20% nor the deductible, you would not be able to collect. In some states, Medicaid would pick up some of that, and so then the cost-sharing provisions would be a little less strenuous on the chiropractic office. That's not the case in Illinois unless you happen to be treating a minor that is also a QMB. Then at that stage, then Medicaid may pick that up. But there's some confusion that comes into play when we start talking about some of the managed care organizations in Illinois that handle Medicaid. Now, I also want to make sure that this is clear. The patient may have a Medicare Advantage program, same rules apply. Now that's going to be a little less frequent. We're typically talking about standard Medicare patients. And one of the reasons for a lot of the complexity is it's kind of evolving quickly. In fact, we did truckloads of research on this to help out a few of our members last summer, and what we found was the answer was pretty clear, and so we gave out information. Since that time, they have changed the information. They have changed the explanation in the MedLearn Matters articles 6 times in the last in the last 12 months. And so that creates some additional confusion, but we think that things have finally settled down and it's abundantly clear. Now, here's what it comes down to. If it's a covered service, then at that stage, then you are not able to bill those additional cost-sharing items, the deductibles and the coinsurance. However, if it's a non-covered service, then at that stage, you are able and actually are required to bill the patient for those services. So examinations and any modalities that you may perform, those are to be paid for by the patient. Not charging the patient in those cases would actually be a violation of the gifts and inducements laws, so you don't want to fall into that trap either. Now, the big question that most of you are going to have is, how do I tell? How do I know if this Medicare patient that comes into my office, if they are a qualified Medicare beneficiary? Well, most of them are going to know. They have been informed by the carrier that they are a QMB, or they know, and they're going to tell you. That also puts you in a little bit of a bind because you know it's going to be difficult to verify. So what there is there's a system called HETS, and some of your systems, some of your billing software or EMS may have a verification system built into it that you can utilize, where you can check the government's HETS system to see if that person is in fact a QMB. Now, most of your softwares may not have that, but some of them may. If it doesn't, that's okay, because as of July 1st of 2018, CMS is now requiring all the carriers to submit the remittance advice after payment with clear indications that a patient is a QMB. And so what you're going to find is either an N781 or an N782 notification on your remittance advice, and then it will actually have patient obligation as 0. If by chance, in those cases, you've either collected the deductible or you've collected the coinsurance portion from the patient, and you get that notification from the carrier, again, that's N781 and N782. If you get either one of those, at that stage, you're required and obligated to refund the patient those amounts. If you've billed the patient, then you want to stop billing the patient at that moment and make sure that you write that off like you would any other third-party discount. Hopefully this has cleared things up. I know some thoughts were out there that it was state dependent. I want to make sure it's clear that these are actually mostly governed by federal regulations. There is some questions that come into play with Medicaid and what they may pay, but we already know in Illinois for adults, for those who are 20 years of age and up, that Medicaid does not cover any services provided by a chiropractic physician, although we are working on that. But in essence, you have to know that you cannot balance bill for covered services, any deductibles or coinsurance amounts. But you are still required to bill for the other services you perform in your office that are not covered by Medicare. Hopefully this helps you out, and we'll catch you next week.